Hello, my name is Dr. Sabrina Chen-See, and I'm here to talk about natural methods that you can clear mucus from the lungs. Now, we might have excess mucus due to dealing with smoke in the air, as in from the recent forest fires. We might also have issues with excess mucus going into the lungs from colds and flus and other respiratory infections. I'm here to talk to you about things that you can do for yourself, for your family, and even for your clients. Natural things that can help with improving lung health. As you can see from this slide, I am a holistic family wellness chiropractor. This means that I don't just take care of the neck and back pain in adults, I actually care for people of all ages and at all stages of health. We care for elite athletes, young children and babies, office workers, seniors, and people suffering from debilitating chronic conditions. I do have special training to help those with mobility issues, hypersensitivities, neurological problems, and advanced degeneration. By a holistic doctor, we mean that we look after the whole person, in sickness and in health. We also take into account nature. What is normal? What is abnormal? Are we seeing normal, healthy responses to abnormal situations? If so, how can we support the body to respond in the best way? Here I have to show you a couple of the assessment tools that we use in our office. On the left is our baseline health questionnaire. We want to know about your whole condition right now, not only physical problems, but how your mind is working, your behavior, your emotions, sensory issues, and your organs. All of these play a role in telling us what's going on with you at this point in time and give us an idea of how complicated your situation may be. On the right, we have a different tool called the layers of the onion. This is looking at your stresses, injuries, and lifestyle throughout time, right from the very beginning. We want to know what you've been through because injuries and stresses that you've had early on in your life, if not dealt with properly, can cause problems in the future. Are symptoms your friend or foe? When it comes to Western medicine, every symptom seems to be a problem on its own or part of something bigger. Especially right now, symptoms like a cough, fever, or shortness of breath are looked upon as something potentially deadly. When it comes to symptoms, Western medicine looks to suppress or eliminate each and every one of them, regardless of the cause. In natural or holistic health, we don't assume that symptoms are our enemy. We try to see the bigger picture of why the symptom exists and how we can help the body move towards health. We have questions to ask. Number 1, are these symptoms appropriate bodily responses to stresses or changes in the environment? If so, can we change the environment and reduce the stress? Number 2, are these symptoms a part of a detoxification process? If so, how can we support the detoxification process? Number 3, are the symptoms warning about body damage? If so, how can we reduce further injury and help the healing process? Number 4, is there something in our lifestyle that's exaggerating the symptom response? If so, how can we change our lifestyle to reduce the severity of the symptoms? The unifying goal is to learn from the symptoms how to help your body be healthier. Your body, though, can need help but not show symptoms. I want to introduce you to two probably new concepts. One is called pre-symptomatic and the other one is called subsymptomatic. Pre-symptomatic means that there has been some injury, insult, or stress to the body, but you're not yet aware of the damage. Sort of like with the smoke inhalation from the forest fires. Whether you feel shortness of breath, coughing or not, the ashes in your lungs are negatively affecting your breathing and mucous membranes. Subsymptomatic means that, once again, the body is having problems. And once again, you cannot see the symptoms.
The difference between subsymptomatic and pre-symptomatic is that subsymptomatic doesn't have to be before the first time you see symptoms. When people have chronic recurring problems, sometimes it's actually the same problem that never fully went away. It never fully healed. So you've had a problem severe enough to experience symptoms, then got well enough. Your symptoms lessened just enough that they were not noticeable, waiting for the next flare-up. The point of holistic care is not only to deal with the symptoms we see, but to look at your underlying health and do what's necessary to help you be as healthy as possible. In this slide, we're looking at mucus in the head and neck. Mucus is produced naturally in the nose, the mouth, the throat, the eyes, and the ears. It is meant to protect our delicate membranes, to lubricate our mouth and throat for swallowing, for keeping our airways moist, and trap foreign particles so they don't enter deeper within the body. These particles can be smoke, dust, smog, viruses, bacteria, and even food. Now, what would cause an increase in mucus? We make more mucus if it's windy and dry, or if the air is full of particulate matter. We also make more mucus if dry food tickles the mouth and the throat. A big reason why people have increased mucus production is as an immune response, such as respiratory infections, sinus infections, eye infections, ear infections, tooth infections, allergies, and food intolerances. These can all make your body produce excess mucus. The normal exit for the mucus is down the digestive tract or through your lymphatic drainage. If these normal exits are not used, then the mucus can enter the lungs or back up into the eyes, nose, ears, mouth, or sinuses. Excess mucus in the head and neck can cause problems. If it backs up into your eyes, you might feel itchy, watery eyes. If it backs up into your ears, you might have disruptions in hearing, feel extra pressure in your ears, or experience ear pain. It might even throw off your balance by affecting your inner ear. You may develop a runny nose or a stuffed up nose. Excess mucus in the throat can trigger coughing fits to try to expel the mucus, depending on how gummy or fluid the mucus is. All of these symptoms are uncomfortable, and so next we're going to be talking about what we can do to help relieve that mucus congestion.
The first technique that I'm going to be showing in helping with clearing congestion in the head and neck is called the cervical lymphatic drainage massage. This is shown with the patient lying down, or the client lying down, because it's how the client can be most relaxed. For cervical lymphatic drainage massage, I usually use 2 fingers, the third finger and the index finger, and the flat pads on them. With this, I'm going to do little circles, massaging from under the chin, along that jawline, all the way up to the ear. We cannot skip this top part here. And then down the side of the neck, over here we have a very nicely defined sternocleidomastoid muscle, where we're going to massage in front of it and behind it. If there's a lot of swelling, you won't see this muscle. Just massage down the whole side of the neck if you need to, and then you finish off with a sweep above and below the collarbone. So it's a Z pattern from the chin up to the ear, down the neck, and across.
The point of the cervical lymphatic drainage massage is to move any congestion out of the head or neck area along the lymphatic drainage routes. This way, it doesn't back up into the sinuses, the eyes, the ears, the nose, the mouth, or throat. We can use topical agents to help with this massage, something like Tiger Balm, Vicks, or oil of oregano. These agents will help heat up the mucus so it can be more fluid and then drain more easily and quickly. Because some people have very sensitive skin, do not apply directly on the neck to start. Try a little bit on the skin on the inside of the client's wrist to see if it burns the skin or creates a rash. If there is no reaction, then you can try it with just a little bit on the neck itself. Now, if there is any broken skin, like cuts or rashes, do not attempt with any topical agent. The next technique that you can use to relieve congestion in the head is through acupressure points on the sinuses. These acupressure points act as release valves for the skull and help congestion exit from the sinuses. On this picture, I want you to focus on numbers 2, 3, and 4. In number 2, you're going to press with your 2 index fingers on the inside edge of the eyebrow. Press on the bone and follow through with pressure from the inside of the eyebrows to the outside edges. Follow the arrows of the orange too. This point is to relieve congestion over the eyes. Next, we're going to move on to number 3, which is the dark purple. So at the bottom of the nose, on both sides, you're going to press down, and then you're going to continue to press downwards and outwards. Both number 3 and number 4 are to relieve congestion in the nasal sinuses. Number 4 is a little bit higher up on the nose, just under the eyes. You're going to press as per the picture, and then you're going to press downwards and outwards. With all acupressure, you want to use the flat pads of your fingers, not your fingernails. Please don't press so hard that it hurts your client. Try it on yourself first and see how it feels. Now, if you don't have any sinus congestion, it won't hurt at all. If you do have a lot of sinus congestion, however, it can be very tender. Please err on the side of being too light. You can repeat the acupressure 2 to 3 times, and you can focus on the area where it feels more congested. So if someone has itchy, watery eyes, focus on number 2. If the nose is congested, focus on number 3 and 4. When you are doing the lymphatic drainage massage and pressing on acupressure points for the sinuses, you are actually releasing mucus from storage areas in those sinuses and the lymphatic drainage and sending the mucus into the body. That's why I recommend drinking lots of warm water. This way, we help flush the mucus out of the body entirely through the urine. If you eat and drink a lot of cold items, though, you are cooling down the mucus and helping it be more gummy and thick and harder to drain properly. If you have lots of congestion, then avoid dairy products and sugar. Dairy products and sugar are notorious for increasing mucus in the body. Finally, I recommend a humidifier. The water vapor from the humidifier is good for trapping smoke or particles in the air and for moistening the air you breathe, so you don't need to make as much mucus in the first place. Now we're going to talk about the congestion in the lungs. Where does congestion in the lungs come from? Well, it can be environmental. There can be particles like smoke, dust, smog, mold, asbestos, and cigarette smoke. It can be from infections like bronchitis, pneumonia, or tuberculosis. The congestion can also be secondary to upper respiratory tract infections that have made their way down into the lungs. Medications that prevent coughing can mean it's easier for particles, germs, and congestion to move from the upper respiratory tract down into the lungs. You can also have fluid in the lungs, as in water from drowning, or there can be blood in the lungs. Another source of congestion can be an overproduction of mucus itself, or narrowing or blockage of airways, like with asthma. Congestion in the lungs is a big deal. Chronic lower respiratory diseases are the leading cause of death in the U.S. If a person is already very weak and sickly, a lung infection can be the last straw. The inability to breathe is literally what takes away the person's last breath. It's because congestion in the lungs is such a big deal that I prepared this talk.
Now I'll be teaching you a technique that you can be doing to help with congestion that's reached its way into the upper lungs or the upper chest. I'm going to start with something called chest percussion. Now, obviously the client is lying down nice and comfortable. I'm going to take my hands, put it gently on the top of the chest, and ask the client, can you take a deep breath in and out? And I breathe along with the client to help them out. So breathe in and breathe out. Now when the client is breathing out, I'm doing a vibration gently with my hands. So again, breathe in and breathe out. On the last time, we're going to do something a little bit different. On the breathing out, we'll be vibrating and then a small pulse at the end. This is to loosen up even more of the congestion so that the patient can cough it out. So let's do it now. Breathe in and breathe out. Okay. Now, if your client has a lot of mucus and phlegm inside their chest, they will be coughing things out right away. If there's a lot coming out and they're having trouble, have them turn over onto their side a little bit so things can get out. If it's not that much, you can continue on through all three. Do be mindful that you don't push too hard and hurt the client. Now I'll show you a different variant of the chest percussion. The first one will be if a person is not lying down. They're in a wheelchair or sitting up. Instead of doing the vibration this way, when someone's lying down, you can either use your fingertips and tap up or even use fists. Now you can do it for the client and the client can do it on themselves. That's for the front. Now, when the client is sitting up, we can also do the back. So we can use fingertips both front and back. We start from the lowest part that we can reach comfortably and then tap all the way up to move the mucus up. Another way to help the patient or client, if they're seated, especially if we can't reach the back when they're sitting upright, is to have them bend forward. And then you can tap with the fingertips, bottom up. And if you want to go deeper, you can use a flat hand, bottom up. Sort of like burping a baby. And come on up. If the client starts coughing, that means you're doing a really good thing, and let them cough before you continue further.
The reason why we do the chest percussion, either lying down or sitting up, is to loosen the mucus and particles from inside the lung membranes. Once we can loosen up that mucus and particles, we also want to stimulate an effective cough reflex. This way, the client can actually expel the excess mucus from the lungs and the chest. We do want the client to start coughing. Even if a client doesn't cough right away, we are loosening the particles and mucus to help the body dispose of the mucus and particles in a safer manner. To help out with the process, we can use the same topical agents that we used for the cervical lymphatic drainage massage. You can use Tiger Balm, Vicks, or oil of oregano and massage it into the chest, both on the front and on the back. Once again, make sure the skin doesn't have a bad reaction to it before you use it on a wide area. Err on the side of caution and use very little at a time. The heat from these topical agents will also help liquefy the mucus to make it easier for it to move out of the dangerous areas and into the proper disposal routes. Just as before, we want our clients to drink a lot of warm water so that the body can flush out the excess mucus. And we want to limit or avoid pro-inflammatory foods like dairy products and sugar. Also, stay away from cold foods and drinks, which causes the mucus to thicken and gel and make it harder for you to get rid of it. Once more, a humidifier is very helpful in the room, especially at nighttime when you're trying to sleep or when you have a sedentary lifestyle. Please take some time now to practice the action steps that I've described earlier: the cervical lymphatic drainage massage, the acupressure points for sinuses, the chest percussion vibrating lying down, and the chest percussion or tapping sitting up. These techniques are safe for people of all ages, from babies all the way to seniors. Please start gently. We don't want to break any ribs. Also, please start with very little, if any, of the topical agents. For the very youngest children, don't use any topical agents at all. We would hate for them to rub their hands into it, then rub their eyes, because that would be very painful. I hope you use these techniques on all your clients who need help with their breathing and congestion, whether they are in a serious state or not. There will be those clients who want more help or need more help with their health. I want to let you know how chiropractic care can be very beneficial, especially when it comes to facilitating breathing and the relieving of congestion. Chiropractic works on a very different level than symptom relief. First, chiropractic adjustments can release joint fixations in the rib cage and spine. When the joints can move more easily, then that means that the chest can expand more with every breath. Increased rib cage mobility improves lung capacity and helps one have a stronger cough without pain. Next, chiropractic adjustments improve nerve communication to better coordinate the muscles for breathing and for coughing. The third effect of chiropractic is improved brain and nerve coordination of circulation and the immune system itself. With this, the lymphatic system drains mucus much more easily and more effectively and more automatically. The immune system can also work much better. With better brain awareness and coordinated action, the immune system can respond quicker to problems and in an appropriate amounts, so that it is enough to be effective, but not so much that the immune response is harmful in itself. Chiropractic care for wellness is all about taking care of the whole person and helping the body be as effective as possible in any situation. Right now, with forest fire smoke and cold and flu season, all our patients are getting extra help with their breathing and relieving mucus congestion.
Thank you for having me here. I love giving talks on different health issues, and I hope that this talk has been helpful for you. If you have any more questions about our practice or about this talk or about other speaking engagements, please give me a call. Our number is 604-566-9088, and you can learn more about our office at www.familywellnesschiro.ca. Have an awesome day.